Member for Clark, Leader of the Greens.
Thank you, Mr Speaker. My question's to the Premier. Premier, on Friday you announced the plan to reopen to Tasmania to travellers on 15 December. You will understand the knowledge that COVID is coming to Tasmania has made many Tasmanians very uneasy, particularly the immunocompromised and those with chronic conditions. Your decision is based on modelling undertaken by the Kirby Institute, which paints frightening scenarios whichever way you look at it. Even under the best-case scenario, with movement restrictions, masks indoors for everyone over 12 and 80% contact tracing, it's projected 87 people will die within the first 6 months. Under that model, with the current level of movement restrictions, 242 people will end up in our already overstretched hospitals and 68 in the ICU. Premier, healthcare workers are stressed about what reopening will mean for the health system. They're already working themselves into the ground just to manage the normal day-to-day demand. Premier, are you certain our hospital system and ICUs will be able to cope once we reopen? Because the Greens aren't. And are you absolutely certain reopening on the 15th of December is the right decision by the Tasmanian people?
Honourable Premier.
Speaker, I thank the Leader of the Greens for that question. And it is an important question and an important issue that we're dealing with at the moment. Now, there are a number of matters that you raised in that question. Firstly, in terms of the immunocompromised, the booster shots are being made available to those people at the moment in that cohort. In terms of the December 15 date, let me just run you through our thinking in terms of that. The modeller provided a range of scenarios based on Tasmania starting with a seeded event of 10 cases on the 1st of December. At a time when we would have had 90% of the over 16 cohort having received a full vaccination, and then with the 12 to 15s coming on later, full immunisation being achieved sometime in January. We're in a better position than that. And I think, and that's one point I want to make to Tasmanians, we're in a better position than that we expect that we will have 90% of the over 12s, so including the 12 to 15 cohort and that 16-plus cohort at 90% by the first week of December. So we'll go into this with that cohort fully vaccinated to more than 90%. Importantly, we put in place measures at our borders, which other states, I think Queensland might be doing something similar at 80%, a little bit later than what we open our borders. But this won't be open slather. And I make no apology for slowing down travel into Tasmania. I know that will annoy the tourism sector. I know that it will annoy some that want to come back and visit family and friends. But there will still be gates to get through. The first gate will be that you will need to have a negative test within 72 hours of travelling to Tasmania, and you will need to be double vaxxed. Now, that will slow travel. The test that will be utilised at the moment, Public Health are recommending the PCR test. Obviously, there are other tests that can be purchased cheaper, but others, their efficacy is not as good. But that's where we stand at the moment. Importantly, in terms of the levers that we have available, and the modeller provided a range of different scenarios. One with the current level of restrictions that we have in place, which is 10% restriction on movement. Another was a 30% restriction on movement, which is broadly where we were the middle of last year into the last half of last year, with 1 in 4 square metre densities and lower caps in terms of public gatherings. Whereas at the moment we're at 1 in 2, and we have obviously the caps in place and also the events management framework that's wrapped around it. That's one of the levers that we have to pull if we need to. I know that this will concern people. I know and understand, because believe me, I've got a family, I live in this state as well. And I know that we have had the rare opportunity over the last 18 months of having one of the best runs in terms of COVID out of any jurisdiction in the world. Yeah. But we have to once again rejoin the world. And the best protections that we can put in place are that we have the highest level of full vaccination that we possibly can.
So is the 15th of December absolutely locked in your mind?
The 15th of December is locked in. We need to work towards that. And I would say to people that maybe thinking like they might when they purchase a ticket to a show or they try to book into a restaurant or they want to go to a festival. Don't wait to the last minute. Get your vaccination and get it now. They are available. And as I've said, there are two things that I need to be very comfortable with. And I say this both as a Premier and as a human being. Firstly, I need to know that everybody has had the opportunity that is eligible for the vaccine.
That's right.
Whether they take it or not is a matter for them. But I need to know that everybody has had that opportunity. And I am confident with the work that has been undertaken with the rollout of the vaccination program that vaccines are available and that people can access them. And we will do whatever we can over the next month or over the next 7 weeks to ensure that we roll out the mobile bus, that we take vaccines to far reaches of this state to make certain that people have that opportunity. The second thing is I want to see the state vaccinated above 90%. But the 15th of December is the date that we're going to reopen, albeit with travel restrictions in place. And as I say, in my mind, it will slow the number of people that will come to the state through that first period, which will provide us... Sorry?
But COVID will come.
I've always been clear about that. You and I, we've discussed this privately, we've discussed it publicly. At some stage, COVID will come and we will need to manage it. Now, the best way of managing it, the best protection that we've got is to ensure that we've got as many people, as high a percentage as we possibly can of the people in this community that are vaccinated. Secondly, we've taken steps to ensure that our health system has additional capacity. So we've got more beds that we've opened, we've got more staff that we've put on, we continue to hire more staff. Importantly, we will offer a range of options for people to ensure that we can provide the services that they need. But the most important thing that people can do is to ensure that they don't forget, as many have done, that COVID is still loose out there in the world and one day it will be here. This is no time for complacency.
That's right.
Make certain that you continue to have good standards of hygiene. Wash your hands, cover your coughs and sneezes. Do the little things. As my mother would have once said, when you're trying not to get the flu. Do the little things. Make certain that you abide by social distancing. Make certain that if you don't feel comfortable going into a big crowd that you don't go. Importantly, if you're feeling sick, if you've got a sneeze or a sniffle, don't go to school, don't go to work. Most people deal with the flu that way. We've got to start ensuring that we deal with COVID that way. Right. But, Mr Speaker, I am confident when we reopen our borders on the 15th of December, with the steps that we've taken, with the measures that we have in place, that we can manage this. But my message to Tasmanians is the borders will open on the 15th of December. Make certain that you get vaccinated. Don't leave it till the last minute. Take a level of personal responsibility and together we will get through this. We will rejoin the rest of the world, but we'll do it at our pace and we'll do it in a way that ensures that we can manage any of the outcomes from it.